of Nigerian Medical Association, River State, the Director of Medical Services, River State Ministry of Health, gentlemen of the press. I don't know whether to say it is my pleasure to sit with you this morning to discuss these issues, because it is not pleasant. When we set up the Anti-Quackery Committee of the River State Ministry of Health, aimed at sanitizing our healthcare environment, we hoped that it would have sent a very strong message in a very short time. And those practitioners that have been conducting themselves without the necessary licensing, without the necessary qualification backing, the necessary personnel to deliver healthcare services, we hoped that they would find a way to correct whatever establishments they had going on by seeking the advice and guidance of the River State Ministry of Health on how to proceed with their practice and the services they provide in their facilities. Unfortunately, we have 3 facilities that have had to be sealed in the last week. The Adewan Hospital, located in Bori, Kana local government, the St. Thomas Hospital in Eleme, and the Caprica Spa in Port Harcourt. Now, the Anti-Quackery Committee, working very closely with the Nigerian Medical Association, looks out for certain things. First of all, it's not just about the building facade and the facility itself. The manpower who are delivering such healthcare services must have the requisite qualification backing, the requisite licensing and registration for them to carry out certain services. Now, for the 2 hospitals, they have been run by practitioners. They are indeed doctors, but in several cases we have identified that even the subsequent surgical training required to carry out surgical procedures is lacking. For most of the surgical procedures, they are using unqualified personnel to deliver surgical services. Now, those are recipes for disaster. And so for everyone who walks into such facilities, their lives are at risk, because the personnel there do not have the necessary training to ensure that quality medical and surgical services are provided in those facilities. For the Caprica Spa, the proprietor is, I think, an engineer with a so-called aesthetic certification that is neither recognized nor can be identified. And this facility is providing liposuction, body part enlargement services, advertising and promoting via social media, and enticing an unsuspecting public to their facility. We don't take these incidents superficially. We are in a climate where all sorts of things can take place under the guise of medical and surgical services. We know that there is a booming market globally for organs. A place can portray themselves as providing body enhancement services, but there is a more sinister motive behind it. And that is why we will not say that it is purely for the financial gain of whatever body enhancement services they are providing. For as long as their doors are open under a false premise, meaning they are not qualified, trained or qualified to provide such services, it is therefore criminal acts that are taking place in such establishments. And so, even despite the fact that their facilities have been sealed, which we are publicly notifying now, further steps are being taken by the committee to ensure that they face the full wrath of the law, because they are jeopardizing the lives of people in Rivers State where they established these facilities providing such services. It also brings me to the issue of medical outreaches. Over the last several months, in several different fora, we have mentioned that the Rivers State Ministry of Health is meant to receive information about planned medical outreaches. It is not just for the sake of information for information's sake. It is because part of our oversight on the health sector is that we are sure that healthcare services, wherever they be provided, either in health facilities or in communities, are provided by the requisite personnel. So when we engage with the planners of such medical outreaches, we want to also know who will be providing what service. What are the qualifications of those individuals? So that we can carry out our own due diligence and give a seal of approval for any such outreaches to take place. And so, part of this briefing this morning was to put on notice the general public that no non-governmental organization, no private or corporate body, no church, mosque or religious group, individual, philanthropist, private hospital, or any entity whatsoever should organize any so-called free or even paid medical outreach without written permission from the Rivers State Ministry of Health. Certain organizations have been doing this properly, notifying the ministry and of their plan for outreaches. We engage with them and the necessary permission is granted for the outreaches to take place. But there are some who go behind, plan and execute their outreaches. Some we have received information from different quarters about outreaches that we had no idea about here formally in the Ministry of Health. It once again brings me to the issue of the vulnerability of people who access healthcare services of any kind. Once they submit themselves to such outreaches and there are nefarious plans behind it, it means they have subjected themselves to be taken advantage of. And this is where we take this charge of the ministry very seriously. And we are putting the public on notice that please, if you get wind of any free medical outreach, ask the right questions. Do they have the clearance of the Ministry of Health to conduct such outreaches? It will be unfortunate if vulnerable members of society, because of the quest for affordable or free medical care, fall into the hands of those who are just seeking advantage. Please. That is part of the purpose of this press briefing today, and I'll be handing over to the chairman of the Anti-Quackery Committee to speak further, and we'll take questions from yourselves.